Hey, this is Dr. Karan from DrPKLyfe. And by the way, I wanted to let you guys know that every Saturday, 11 o'clock Pacific time, I'm going to be doing TikTok live. So you're more than welcome to join me. Today in this video, I wanted to discuss PCOS. I'm sure lots of people are familiar with the PCOS, is Polycystic Ovarian Syndrome. And the reason I wanted to discuss, because this week I had a few cases and all of them were misdiagnosed. And I have seen it before as well. So some basic understanding will help you to know if you have PCOS or something else. So we're going to dive deep in Polycystic Ovarian Syndrome, PCOS, a common but frequently misunderstood condition. We'll cover everything you need to know about this diagnosis and common misdiagnosis and the best treatments available. If you or someone you care about has PCOS, stay tuned. This information could literally change your life. So what is PCOS? PCOS is hormonal disorder affecting millions of women worldwide. It leads to irregular menstrual cycles, increased male hormones, androgens, and cysts on the ovaries. And common symptoms: irregular or absent periods, excess hair growth on the face or body, acne or oily skin, and difficulty losing weight and thinning hair on the scalp. How is PCOS diagnosed? Diagnosing PCOS can be tricky because there is no single test as such. Typically, the doctors look at three main criteria, and you need 2 out of 3 to confirm the diagnosis. Number 1, irregular menstrual cycles, fewer than 9 periods per year, or cycles longer than 35 days. Number 2, high androgen levels shown by blood test or physical symptoms like excess hair, acne, or larger than usual size of clitoris. Number 3, polycystic ovaries seen in the ultrasound test. It has to be more than 12 of them. So thorough evaluation also includes ruling out other hormonal issues like thyroid problem and adrenal gland problem. So what is common misdiagnosis? Well, in my patients, they did not meet any of those criteria, and they were seen by nurse practitioner in women's clinic, and they were told that they have PCOS, and just by having this diagnosis slapped on your face, just imagine the mental toll it takes on women. And so I had to give them good news that no, none of them had PCOS. The issues was mainly weight-related menstrual issues. So PCOS is often misdiagnosed because its symptoms overlap with other conditions. Number 1 is thyroid disorder. So make sure your thyroid tests are done. Adrenal gland disorder. Adrenal gland hormone production, overproduction can lead to this. And there's one test that can be done. It's called DHEA sulfate. And if that test is positive, it means the issue is adrenal gland. Premature ovarian failure, that can also cause PCOS-like issues. Weight-related menstrual irregularity is the most common confusing picture I've seen in my practices. So incorrect diagnosis can lead to inappropriate treatment and prolonged suffering. So this video is for you to know exactly what's happening so that you can ask your doctor to do things correctly. Always consult a doctor and ask for second opinion, third opinion, consult with a GYN or endocrinologist before you know and you can confirm the diagnosis or not. Why is diagnosis so critical early in life? The thing is that early and accurate diagnosis of PCOS is essential to avoid long-term complication like infertility, type 2 diabetes, cardiovascular issues, sleep apnea, mental health like anxiety and depression. Earlier it is identified, the sooner effective treatment can begin. So what are the treatment options for PCOS? Good news is that PCOS is highly manageable. People think that if they have been diagnosed with the PCOS, life is over, but that's not the case. That's just not the case. Lifestyle changes is number one. You want to have a balanced diet, low glycemic food, get rid of all the sugar and fast food, frozen food, and fat food from your life. And so get rid of all the sugar, fast food, frozen food, and fatty food from your life. Regular walking, exercise will increase insulin sensitivity and weight control. Medications, birth control pills that regulates your periods and hormones. Other medication is metformin that will improve your insulin resistance, and anti-androgen medication to reduce excessive hair growth and acne like aldactone or spironolactone. Supplements and holistic approach. Inositol improves ovulation and insulin sensitivity. Vitamin D is often deficient in PCOS, so that needs to be supplemented. Herbal treatment like spearmint tea can also reduce androgen levels. Emotional and psychological support is extremely important, and that in particularly if somebody has been misdiagnosed and had to live with this stigma and impacts mental health significantly. It's crucial to seek support group and consider counseling and manage stress through mindfulness and other relaxation techniques. You are not alone, and emotional well-being is as essential as physical treatment. So final takeaways, always advocate for yourself, seek second opinion, a specialist opinion if you're not sure. Lifestyle modification can dramatically improve your symptoms. Stay informed and be proactive in managing your health. Thanks for watching it today, and if you find this video to be helpful, subscribe and like it, and please join me in TikTok live video session every Saturday 11 a.m. PST. I'll see you there. Thank you.